How to care for newborn puppies, feeding and disease prevention. Basic medical care for newborn puppies. What are the medical concerns when raising orphaned puppies? Here's some basic information about what's normal and what's not. Temperature. A normal rectal temperature for a newborn puppy is 95 to 99 degrees Fahrenheit for the first week, and 97 to 100 for the second week. By the fourth week, the puppy's temperature should reach the normal temperature of an adult dog, 100 to 102 degrees. Puppies under the age of about 38 days have a reduced ability to regulate their body temperature and will need a temperature-controlled environment. Weight. Weighing the puppies daily to check for weight gain can reassure you that they are doing well. If a puppy is failing to gain weight or losing weight, you should consult with your veterinarian. Vision. Puppies' eyes open when they are 10 to 14 days old. Because their eyes are very sensitive to light, they should be kept out of direct sunlight until approximately 4 weeks of age. Hearing. The ear canals of puppies open between 5 and 8 days. Warmth. A puppy burns far more body heat per pound of body weight than an adult dog. To stay warm, puppies depend on radiant heat from their mother. In her absence, they need constant temperature control. So, you'll have to provide your puppies with a draft-free nesting area. Heat lamps or hot water bottles can be used to keep the temperature controlled. During the first 4 or 5 days of life, puppies should be kept in an environment that is between 85 and 90 degrees. The temperature may gradually be decreased to 80 degrees by the 7th to 10th day, and may be reduced to 70-75 degrees by the end of the 4th week. Provide necessary warmth or cooling to the puppies gradually. If you have a large litter, they will huddle together, which means they won't require as much help with external heat from you. Take care not to overheat the puppies. Newborns cannot move away from the heat on their own. Stimulation for elimination. For the first 2 weeks of life, puppies are stimulated by their mother to encourage urination and defecation. In the absence of their mother, you will have to provide the stimulation. Massage your puppy's genital area with a moist cloth to stimulate bladder and bowel action. After 2 weeks, puppies should urinate and defecate on their own. Watch them carefully to make sure that happens. Diarrhea. Diarrhea is common in puppies and may be caused by parasites, viruses, bacteria, food changes, stress, overfeeding and other causes. If the diarrhea is mild and the puppy is otherwise alert and vigorous, you can try giving less food more often and monitor the pup closely. Also, make sure that the puppy gets a lot of fluid, as they are prone to dehydration if they don't get enough. This can be done by diluting the formula with extra water, or giving the puppy clean warm water in a bottle or syringe. If the diarrhea is severe, lasts more than 3 or 4 feedings, or contains blood or obvious parasites, you should call a veterinarian. Dehydration. The lack of normal parental care may mean that you receive puppies who are dehydrated. They may also become dehydrated from other causes, such as diarrhea, vomiting or by being chilled. Newborns can't nurse if they are too cold, because their energy is spent trying to stay warm. One sign of dehydration is loss of elasticity in the skin. If you pick up the pup's scruff with 2 fingers, it will stay up, looking pinched. Another way to test for dehydration is to look at the puppy's gums. The gums should be moist and shiny. If you touch them, they should not be sticky. Hypoglycemia. Hypoglycemia, an abnormal decrease of sugar in blood, can also happen to orphaned puppies. The signs to look for are lack of strength, lethargy, and muscle twitching. If a puppy shows signs of hypoglycemia, place a few drops of corn syrup under his tongue and on the gums, and call your veterinarian immediately for further assistance. Internal parasites. If a puppy is developing very slowly, has an extremely large bloated belly or has blood in his stool, he may have internal parasites. A stool sample should be taken to your veterinarian for examination.